Hello everyone, welcome to our today's session on intestinal stomas or enterostomas. I am Dr. Rajesh Shinde, working as a dedicated gastrointestinal, HPB and colorectal cancer surgeon at Apollo Hospital, Navi, Mumbai. Today we are going to talk or discuss about the common issues that are faced by our patients with intestinal stomas. Before coming to the stoma, I would like to reiterate or quote that colorectal cancer is one of the most common diagnosed cancer worldwide. Actually, it is the third most common cancer diagnosed all across the globe with more than 10 lakh, that's 1 million cases who are diagnosed annually across the globe. It is a false myth or a false belief that most of the patients with colorectal cancer will get intestinal stomas and they will have to live with the colostomy or the ileostomy bag all over their life, but it is not right. In fact, only a small proportion of patients, that is less than 20% of the patients with colorectal cancer, will develop some kind of a fecal diversion during their treatment, which we called as a stoma. And most of the time this stomas will be temporary. That means once the patient's treatment is completed, the stoma will be closed, and only less than 5% of the patients will have to live with the stomas permanently. So today we have with us our enterostomal therapist, staff nurse Ruchita. Welcome, Ruchita. So we will discuss about the colostomies and the management of the colostomies today. So Ruchita, can you tell us what is stoma?
Thank you, sir. Stoma is an opening which is created on the abdominal wall by manually to empty the contents of bowel and bladder.
What is stoma clinic?
Sir, we have our colorectal team that comes as a clinic. In our clinic, we have specialized surgeons, enterostomal therapist, a physiotherapist, dietitians, and psychiatrists. This form a team, and we are here to help the stoma patients.
So basically, stoma clinic is a team of people who are involved in day-to-day issues of the patients with stomas. The team includes surgeons, enterostomal therapist or a stomach nurse, dietitian or nutrition, and a psychologist. All these people will work in together and try to address the issues on different levels which are faced by the patients with the stoma. So, Ruchita, can you tell us what are the different types of stoma?
So, according to the area, we have colostomy, urostomy, and ileostomy. Ileostomy means the part of the small intestine ends and the starting of our large intestine. It is called an ileum. So, we have a stoma created in ileum, so it is known as ileostomy. Same as colostomy. Colostomy is the stoma which is created into our large intestine to empty the colon contents. For urostomy, we have the stoma created to empty the contents of bladder.
So, what are the types of stoma? Like, what is temporary stoma and what is permanent stoma?
Temporary stoma means after a certain while, the colon, when it has been treated out, it is especially in ulcerative colitis or Crohn's disease, after healing off, it is placed into back position. So that is called as a temporary stoma. In permanent stoma, when there is some cancerous lesion, we have to remove that part of the colon and it becomes a permanent stoma.
Okay. So, Ruchita, can you tell us what are temporary stomas and what are permanent stomas?
Temporary stomas are specially created stomas to divert the fecal matter from a specific area which area needs to be healed out. In permanent stoma, when there is a tumor or cancerous cells in the lower part of our anal canal, which tends to be removed off, in that which the permanent stomas are being created.
Okay. So, Ruchita, what are the types of stomas?
So there are three types of stomas: colostomy, ileostomy, and urostomy. For colostomy, large intestine is being involved. We have a stoma, specially created stoma for emptying the large intestine contents. For ileostomy, ileostomy means the part where the small intestine went and the large intestine starts off. So there is a stoma which has been created to empty the contents of the ileostomy. Then we have urostomy. Urostomy has been created whenever there is cancer of bladder, to empty the contents of the bladder.
Okay. So Ruchita, can you tell us about how to take care of the stomas? And what are the
So,
things which needs to be taken care of or looked after in a patient with stomas?
so whenever we receive any patient in our clinic who will be with stomas, we give preoperative counseling with different, showing on actual demonstration of what is stoma and how the products will be helping you out and how will be the management of stoma. Post operatively, we also help them with the adapting their relatives and the patient with the stoma bag and the stoma management.
So, in other words, stoma care starts before the operation, that is, before the creation of the stoma. It starts from the psychological counseling of the patients, wherein they are explained what is stoma, what your surgeon is going to do, and where will be the stoma. Second step will be about marking of the stoma, which kind of stoma is going to be made, and once the stoma is created, how to take care of that stoma, that is how to apply the bag or the appliance, how to empty the bag, and how to identify the problems which can happen if the bag or the appliance is not used properly. Is that right?
Yes.
Yeah. So, Ruchita, are there any specific modifications or the precautions which these patients with stoma have to take?
Yes, sir. Whenever a patient have a stoma, it is always taught by us that the stoma bag should be cutted properly to avoid bleeding and avoid excoriation of the skin. So, major things that happens with these stoma patients are leakage and the excoriation of skin. So, proper management and proper guidance has been given by us to prevent all erosions, excoriations, and the bleeding from the stoma.
Ruchita, these patients with stoma, do they need to have any restrictions on the food or any physical activities, or they can live normally?
No, sir. They don't have any restriction. They can live normally. They can walk. They can play badminton. They can swim. They can carry out their all the activities what they used to do before having a stoma. They can have all the diet what they used to have before the stoma creations. They can attend uh, gatherings. They can attend these seminars. They can attend each and every
Event or a
event in
function?
their life they have. They are having.
Okay. So, in other words, if any patient is having a stoma, he doesn't have to care at all. He can live his life absolutely normal. There will be no restrictions whatsoever in terms of food, diet, or any physical activity, exertion, exercise. They can do whatever they want to do. It's just a psychological barrier where patient thinks I have a bag and I cannot do this, I cannot do that, but it is not the case. Once the stoma is created and once the patients are fully aware of how to take care of the stoma after a thorough training from our side, they will not have any restrictions on their day-to-day lifestyle, right?
Yes.
Yeah. So, Ruchita, can you tell us what are the different types of stoma bags and when will you choose which bag?
So for different stoma, we have different bags. Starting with all over the world, we have two types of bag: one-piece bag system and two-piece bag system. So one-piece bag system is a bag where base plate and the bag has been attached, and you just need to cut it, pull the wrapper off, and you have to stick it. In two-piece bag, we have the base plate and the bag separately. In profit in this is whenever your bag gets soil or your bag get leaks or your bags perforates, you can only change the bag and you can attach the another bag and you're ready to go.
Okay. And when should the patient ideally empty the bag? Whether the patient has to wait for the bag to get full or they have to empty the bag before it gets full.
So they have to empty the bag before it gets full. When it is three-fourth filled, we have to empty the bag. Or whenever there is bloating or there is gas formation in it, we patient has to empty the bag.
Okay. And what if some patients has a skin excoriation around the stoma and it is very painful? Can the patient apply the bag?
So, whenever a patient has excoriation, we have something called as a sheet that we need to cut and we need to place, and upon it we can place the bag. So, feces or patient stool will not get directly exposed to the skin, and it will not increase. So, the sheet is been placed to prevent the further excoriation, and it also acts as a treatment to heal it.
So basically, it will act as a barrier, which will help us to help the bag to stick or stay in a proper place. At the same time, it will give a time for the excoriations to heal.
Yes.
Okay. Ruchita, can the patients with stomas, particularly permanent stomas, live without a bag? Is there any arrangement where they can kind of empty their bowel once in a day and do not use the bag?
Yes, sir. We have something called as colostomy irrigation or a bowel wash. Like normal routine pattern, we have a routine pattern of 2 times or 1 time daily. Patient can regain it. So how they can regain it? There is something called as colostomy irrigation. So in the morning, if patients has colostomy irrigation with the water in his stoma and flushing out all the contents, patient can just apply some dressing over the stoma, and patient can move anywhere into the gatherings or into the events
Without applying a bag.
without applying a bag.
Okay. Thank you, Ruchita.
Thank you, sir.
Thank you, everyone.